patient came to Marian Joy after having a spinal stroke, which is a type of what we would consider a non-traumatic spinal cord injury. Being a younger patient in her 40s, this is more unlikely. Being an otherwise fairly young, healthy patient, the status of her spinal stroke left her in a situation where she was well below her baseline. The most obvious aspect that most people pay attention to is the loss of voluntary motor function or the loss of sensation. But what is really important is how it really can affect every organ system in their body. She had predominantly bilateral upper extremity weakness. She did have some lower extremity weakness as well. She also had both neurogenic bladder and neurogenic bowel. What essentially that means is that there's no structural issues to the bladder or the bowel, but the nerve connections that go down there are impaired as a result of their injury. One of the medical complications was also orthostatic hypotension. Spinal cord injury can affect the regulation of your cardiovascular system. And so as a result of her orthostatic hypotension, she had a lower resting blood pressure than the average person. As a result of that, when she was experiencing autonomic dysreflexia, which is your body basically goes into a storm. It doesn't know what's going on, and it's created by any type of noxious stimuli. In her case, her bladder descending, her bladder getting more full, was sending basically alert signals to her body. And as a result of that, the way it was mediated is that her blood pressure elevated above its baseline, which already started out at a lower amount, and then she had sweating and flushing. In this case, it was a type of vascular spinal cord injury. Typically speaking, we see this more rarely in terms of non-traumatic injuries as compared to when there's degeneration of the spine progressively that eventually causes compression of the spinal cord. So overall, this case was important and highlight worthy because of simply the etiology being vascular in and of itself. This patient did have risk factors. The major one was the risk factor of having premorbid diabetes. That was relatively uncontrolled. The second area that we probably see more often in terms of vascular injury is when patients have aortic ruptures that causes either compression or lack of blood flow to the spinal cord, or if patients have long cardiac procedures and due to basically bypassing the aorta for long periods of time, they end up with lack of perfusion. So in this case, it was essentially a lack of perfusion to her spinal cord that led to long-term deficits. One of our strengths is that we have specialized programs at Marian Joy. Because having a spinal cord injury can be a very life-changing event, it's very important to anticipate the needs of these types of patients very early on. A lot of the medical conditions that are very specific to their condition, such as having neurogenic bladder, having neurogenic bowel, autonomic dysreflexia, orthostatic hypotension. It takes a very specialized team who's adept, who understands these types of conditions to appropriately treat it. When our patient first came to acute rehab, she was in a wheelchair setting. She could not stand up on her own. She honestly could not even sit up on her own because of cardiovascular issues created by her injury. And she was completely dependent for all of her daily tasks. I recently saw the patient an outpatient about 8 months from her injury, and now she's able to ambulate without an assistive device. She no longer needs any braces. She's able to stand up and walk for long distances without needing the assistance of anybody or any equipment. She's made great strides functionally. As it relates to clinically as well, part of that is because she's able to gain a lot more motor function voluntarily in her upper extremities primarily, and she's able to gain more sensation. The other aspect that's really improved a lot is that she was able to regain spontaneous bladder function, which is a huge quality of life measure for a lot of our patients. Going forward, I do think there needs to be recognition that patients that are otherwise healthy, at least visibly, and are around a middle age can still end up with conditions like a spinal stroke. Patients having early care is really important. Recognition of the symptoms is important. And then it's very, very important for any medical professionals to realize and recognize very early on how it can affect all of the areas of their body.